Hello and welcome to my channel. In this channel, I explain medicine and pharmacy using animation. In this video, we'll talk more in depth about erectile dysfunction or ED, Sildenafil or by brand name Viagra, and Tadalafil or by brand name Cialis. I hope you enjoy this video. Let's start with etiology of ED and some other related stats. ED is the most common type of sexual dysfunction. Its prevalence is expected to reach 322 million by 2025. ED is also more common with increasing age. Almost 30% of men in the US have ED. 52% of men experience some sort of ED in their life. ED affects 10% of men in every decade of their life. Also, we have more than 3.5 million Viagra and more than 1 million Cialis prescribed every year. So, what is ED? We have three types of sexual dysfunctions. Decreased libido, which is a reduction in sex drive. It can be secondary to ED or caused by factors like depression, anxiety, medications, and low levels of testosterone. Next is ejaculatory dysfunction, which consists of few disorders, and the most common one is premature ejaculation. Okay, the most common and subject of our video is erectile dysfunction. Textbook definition of ED is a consistent or recurrent inability to acquire or sustain an erection of sufficient rigidity and duration for sexual intercourse. Simply, it's just difficulty in getting and keeping an erection. Risk factors of ED can help us predict which men are most likely to show signs of ED. First category is cardiovascular, like smoking, obesity, high blood pressure, diabetes, CKD or chronic kidney disease, hyperlipidemia, which is elevated levels of lipids in blood, and obstructive sleep apnea. Second category is psychosocial, like depression, stress, relationship problems, and performance anxiety. Next is neurologic issues like a stroke, spine injuries, back pain, and even dementia. Last one is medications. Most antidepressant drugs like SSRIs, some antihypertensive drugs like amlodipine, and alpha-adrenergic blockers like prazosin and trazosine, anti-androgen drugs which lower testosterone level, some other drugs like spironolactone, clonidine, methyldopa, itraconazole, ketoconazole, and cimetidine. Now let's talk about how does erectile work. First step is arousal. It can be through seeing, hearing, feeling, or smelling something that turns you on. Arousal makes your body release a component called nitrogen oxide or NO. Without arousal, NO doesn't get released. So for Viagra and Tadalafil to work, arousal must happen. Then NO activates an enzyme and results in increased levels of cGMP or cyclic guanosine monophosphate. In step 4, cGMP causes a smooth muscle relaxation and blood inflow. At this point, in men with erectile dysfunction, nitrogen oxide decreases and cGMP starts to break down, which stops the erection. Viagra and Cialis help in this step by keeping cGMP active. So Sildenafil and Tadalafil inhibit phosphodiesterase type 5 enzyme or PDE5. This enzyme's job is to break down cGMP. Therefore, cGMP accumulates and more muscle relaxation and blood inflow causes a firm and long erection. Now that we know what is ED and how does these medications work, let's talk about how to take them. Dosing of Viagra is 25 to 100 mg as needed. For Cialis, it is 5 to 20 mg as needed, or 2.5 to 5 mg once daily. As needed means how much does work for each individual. And once daily method of Cialis is for people who have multiple sexual intercourses during the day or people with consistent ED. Best time to take Viagra is 30 to 60 minutes before sexual activity. You can take it up to 4 hours before. Cialis should be taken at least 30 minutes before sexual activity, and in once daily method it can be taken without any regard. It's better to take Viagra on an empty stomach because a high lipid meal reduces sildenafil's absorption and delays its onset of action. Cialis is taken with or without food. Viagra versus Cialis. We talked about when to take them and their relation to food. Their similar use is PAH or pulmonary artery hypertension, which is basically high blood pressure in the lungs, and also pulmonary edema. Sildenafil is used for Raynaud phenomenon or RP, but Tadalafil is used in BPH or benign prostate hyperplasia. Sildenafil's duration of action is 4 hours. Tadalafil's is 36 hours. Sildenafil's peak of concentration is 1 hour and Tadalafil's is 2 hours. They have usually similar side effects, which we'll talk about later, but as a difference, blue-tinted vision or synopsia mostly happens with sildenafil. Cough, limb pain, and respiratory tract infections are usually specific to tadalafil. Most common side effects of these drugs are headache, flushing, indigestion, and back pain. They also have some significant side effects such as hearing loss or impairment. This is a rare occasion, and it is usually with tinnitus and dizziness. The reason behind this is probably elevation of middle inner ear pressure. The onset is usually 12 to 24 hours after taking the medication. Hypotension happens as a result of vasodilation, usually 1 to 2 hours after taking medication. These medications shouldn't be taken with other hypotensive drugs like nitrates. Periapism is a painful erection lasting more than 4 hours. This is an emergency since it can harm penis permanently. This happens as a result of accumulation of cGMP, and we usually see that in patients with medication overdose. Visual disturbance is another major side effect. This includes blue-tinted vision, blurred vision, or even vision loss. Some lifestyle modifications are very effective in treatment of ED. Weight loss and maintaining a healthy diet is very helpful. Also, physical activity is recommended in men with erectile dysfunction. In addition, gastric bypass surgery, which causes weight loss, may improve testosterone levels and erectile dysfunction. In men with both erectile dysfunction and obstructive sleep apnea, treatment with CPAP or continuous positive airway pressure has been found helpful. Quitting smoking is also beneficial. Now let's talk about who can take these medications. Some conditions may force some patients to not take these medications. Always ask your doctor or pharmacist before taking these medications. Hypersensitivity or allergic reaction to medication. Most common signs of allergic reactions are rash, hives, itching, and red or swollen skin. People with eye problems or color discrimination. It should be used with caution in patients with retinitis pigmentosa. People with hypotension or people who are taking antihypertensive medications. Nitrates such as ISMN or isosorbide mononitrate, ISDN or isosorbide dinitrate, and NG or nitroglycerin. The gap between taking nitrates and sildenafil or tadalafil is 24 hours for sildenafil and for tadalafil is 48 hours. Other medications which we mentioned previously, anatomical penis deformities, bleeding disorders, their safety in this category is not well established, but some studies show PDE5 inhibitors decrease platelet aggregation, which can cause excessive bleeding. Cardiovascular problems, people with hypotension, uncontrolled hypertension, arrhythmias, a stroke or MI in the past 6 months, cardiac failure, and unstable angina. Hepatic or renal impairment, which need dose adjustments. Use with caution in patients with peptic ulcer, sickle cell anemia, and older population. Now as a quick review, erectile dysfunction is very common amongst men, and it increases by aging. Viagra and Tadalafil are being prescribed more than 4 million a year combined. Erectile dysfunction is the most common type of sexual dysfunction, higher than decreased libido and ejaculatory problems. Risk factors of ED are cardiovascular disease, psychosocial problems, neurologic issues, and medications. Mechanism of action of these drugs. First, arousal must happen. Then nitrogen oxide gets released and causes cGMP to activate. cGMP causes muscle relaxation and blood inflow. Viagra and Cialis inhibit PDE5 enzyme. As a result, there are more cGMPs, therefore longer and better erection. Sildenafil is best taken 30 to 60 minutes before sexual activity on an empty stomach. Tadalafil is best taken at least 30 minutes before, with or without food. Tadalafil stays in bloodstream up to 36 hours. Common side effects are headache, flushing, indigestion, and back pain. Significant side effects are hearing or vision loss, priapism, and hypotension. Thanks for watching this video. Please like this video if you enjoyed this. And the last thing I say is a disclaimer. This video was only made for educational purposes, so please do not self-diagnose or self-prescribe, and always consult with your healthcare professional.